Dear colleagues, this research concerns one of the most in focus risk factors currently, that of biomechanical overload of the upper limbs. Currently, the most reported diseases as a result of exposure to occupational hazards are those affecting the musculoskeletal system. Among the possible causes that led to an increase in the probability of occurrence of these, there is exposure to the risk of biomechanical overload, especially in the upper limbs. The main ergonomic recommendations in these regards are provided by the technical standard ISO 11228, which, in its third part, deals with the handling of low loads at high frequency. This standard also represents the main reference which offers the methodology for assessing occupational risk. The cultivation of palm fruit and stone fruit highlights work tasks such as pruning, thinning and harvesting, the performance of which exposes the operators to risk of musculoskeletal disorders. Our assessment was carried out during thinning operation in a peach orchard, adopting the methodology proposed by Daniela Colombini and Enrico Chipinti, known as Okra Mini Checklist. The orchard is structured with an espalier system on an area of about 25 hectares, and the operators who participated in the thinning operations were 12 units, all of them right-handed. A series of 3 videos from 3 different angles were recorded for each operator. The videos were then analyzed with the help of the Kinovia software. The task involves the use of both limbs in a non-symmetrical manner. For this reason, it was necessary to make separate assessment for each limb. The force and complementary factors multipliers do not contribute to the increase of the risk index. The factors that significantly contribute to the obtaining high scores are the presence of incongruous postures of hands and arms, of stereotypy, and of insufficient recovery time. Particular relevance is assumed by the frequency factor, especially for the right limb due to the high number of technical actions carried out in the unit of time. The values obtained are extremely influenced by the frequency of actions. Other factors that influence the results are linked to postures. The incongruous posture assumed in most of the analyzed cases, the arms placed at the height above the shoulder, however, occurs for a period less than a third of the time, and is due to a postural defect present in most of the operators who, although trained, have yielded to the unconscious automatism acquired with experience. Is a reduction in risk possible? The frequency factor can be reduced by acting on the work organization with interventions such as the rescheduling of breaks and shifts. Interventions to correct the postures that contribute to the increase of the risk index are possible by operating frequent education and training campaigns, also using other technologies and using technical aids such as lifting platforms for orchards for the removal of fruits that fall at the heights above the shoulders of workers. Thank you for your attention.